Right, for this part of C3 then, we are looking at something called batch and continuous processes. Now really what we're looking at here is, we're looking at chemical industry and whether they make one product all the time or whether they just make a little batch of them. Okay, so if I sort of try to put that into context, if you think about maybe, I don't know, Kingsmill factory. Kingsmill have to make their 50/50 bread every day, okay, and they have to continuously keep it coming out of the machine. So that means they'll just keep making one loaf after the other, after the other, after the other, and they'll keep going and bagging it up and then sending it to the supermarkets. Now let's just say Kingsmill decide that they want to make some more of their cobs because they're running low. Well, they don't want to make those all the time because they only have a small demand for them. So they might just make one batch of them and do those on a separate machine and just put a certain amount. If they wanted 50 lots of cobs, for instance, then they'd just put enough ingredients in for 50 lots, make those cobs, and then they could not do that anymore. Well, that's the same sort of process as we're looking at when it comes to chemicals, and more in particular, it's places like Pharmaceuticals that make medicines. They can look at batch processes more than anything usually. But the thing you're going to be asked about is, first of all, whether you can recognise if it's a continuous process or whether it's a batch process. So you just need to think about, is this being made for 24 hours a day or is it just a small scale? So if it's 24 hours a day, it's going to be continuous. If it's only small scale, a small batch of them, it's going to be the batch process. And then you might be asked to talk about the advantages and the disadvantages of each. So for instance, if you looked at the cost of the factory equipment, the continuous process is probably going to be quite high because it has to be working all the time and it has to be maintained. Whereas with a batch process, you only need a small amount of equipment because you're only making small amounts at a time, so it's probably going to be quite low. The rate of production, obviously for continuous, that's going to be high, whereas for batch, it is going to be low because you're only making a small amount. Shutdown times. If it's continuous, it's very rare that it shuts down. It's a bit like at Land Rover, the line with the cars on, it just doesn't stop, it carries on and on and on. And that's the same with a continuous process. Whereas with a batch process, you are quite often going to be shutting down in between batches. The workforce needed for a continuous process, you only need a smaller number of people because most of it's done by machines, and like I say, it just needs to be kept an eye on. Whereas with a batch process, chances are you're going to need more people. And then ease of automating the process, basically making it automatic. Continuous, like I said, is going to be high because it's basically just one long line of machines, but batch is probably going to be low. You can't really make a batch just automatically. Okay, so that's some of the advantages and disadvantages. So if we looked at that then in terms of making medicines, because as I mentioned, pharmaceuticals tend to do batch more than continuous, but there are some medicines that are made continuously, especially like antibiotics, and I'm trying to think, like a general antibiotic, I can't think what the word is at the moment, a general antibiotic that is used for lots of different bacterial diseases. So it's often expensive to develop and make new pharmaceutical drugs, and several factors are included. You have to do your research to start with and your testing. So the suitable new substances must be identified, then tested to make sure they are safe and effective. You have to consider your labour costs because you have to have many skilled people. Your energy costs, because of electricity and fuel are needed, and these can be expensive. The raw materials that go into it, it may be that a particular plant has been found that is really a really good compound for your drug, but you can only find it in one little place in the world, so it's going to end up being rare or expensive, and complex chemical reactions may be needed to make the drug for them. Time taken for development. You can't just make a drug and sell it all in a very short space of time. You have to go through a whole long process, and then marketing. Obviously you've got to try and sell the drug as well, so that people start using it. Now in terms of making drugs, you have to go through these few steps here. You've got crushing, so it's usually plant material that's producing these medicines. So plant material is crushed using a pestle and mortar. Dissolving to boil to improve the extract. Chromatography, concentrated solution of the material is spotted onto chromatography paper and allowed to separate. Okay. Now when it comes to developing a drug, it can take a long time, and we're talking about 10 years. But if you think about it, all those steps I talked about, you know, they all have to be considered, and you can't just make a drug and just give it to humans straight away, because you have to make sure it is safe. So the research has to be carried out, the highly qualified scientists are needed. It has to be tested to make sure it works properly, and there's no serious side effects. It has to be approved for use, so it must satisfy all the legal requirements. It must be pure to avoid any side effects, and it can be tested on humans and animals. And there are obviously some issues here, because people say, well, why should you test it on animals? And the reason is because they're as closely related to us in terms of DNA, and it means that we can have a look at the side effects before it's actually tested on humans. They do trials then, where they actually ask people to be part of a drug trial, and people voluntarily, they get paid for it, but they voluntarily sign to say, yes, I'll do that trial. There was a case a couple of years ago where there was a big trial, and all the people involved in the trial ended up either severely deformed, or I think a couple of them died as well, because they tried it on animals and it had worked, but when they tried it on humans, it wasn't as compatible. So this is why it takes a long time. So if you're testing medicines for purity, you've got to make sure you've got the melting point, the boiling point, and like I said, the chromatography, because it should have a single sharp temperature. If it's pure, it will have a certain boiling point and a certain melting point. If it's not pure, it means you'll get different results every time. And the chromatography is to show that when you split the compounds in the actual chemical, that they all show exactly the same every time. So you can see developing medicines isn't that easy. It does take a long time, can be quite frustrating, but in the end hopefully rewarding for everybody.